I'm a male. I feel crappy every day. Not me, but there are many of you out there that feel this way. Maybe you're lethargic. Maybe you're very stressed. You don't have that same libido you used to. Your muscle strength isn't the same. You don't have that body hair anymore. You just don't feel right. You feel like you can't focus as well. Maybe you have low testosterone. And we've done a video on naturally optimizing hormone levels, in particular testosterone, here at When Wellness. You can refer that if you're looking for natural remedies to boosting testosterone. Now, first and foremost, if you do feel like that, what are some things that you should do? Well, you get your levels checked. Make sure that it's testosterone that's the culprit. It could be a lot of other things, right? And so you want to know what your nanograms per deciliter are. On average, they're about, and they vary widely in different age brackets, but for people who are 25 to 30, typically the average is around 500 nanograms per deciliter. For somebody who is anywhere from 30 to 45, it's typically 400 nanograms per deciliter. People are considered to have low testosterone and maybe qualify for testosterone replacement therapy, or TRT, when they have anywhere from 250 to 350 nanograms per deciliter, right? And so, check your levels first and foremost and make sure that's the culprit. Now, if you do find out you have low testosterone levels, some things you're going to want to do is you're going to want to live like that balanced warrior that's well fed. And what do we really mean by that? Well, a warrior, you're going to want to exercise, especially compound lifts, use multiple muscle groups that require a lot of power, and things that require you to lift some heavy weight, not to the point where you're obviously going to get hurt, but that's a big one. Doing compound movements, lifting heavy weight. Getting more sleep is another huge one. Being less stressed is another big one. And diet is huge, right? So your balanced warrior, you need to recover. You're going to work hard. You need to also recover well. And, you can consider intermittent fasting as well. But make sure you replenish with plenty of protein. When we talk about diet, plenty of protein if you're going to do that, or if you're not, and have plenty of healthy fats and right? So if you want to watch that video again, make sure you don't have nutritional deficiencies. We'll cover the big things from it if you don't feel like going back. Make sure you're not deficient in things like vitamin D, or especially zinc, magnesium as well, right? You want to make sure you're not deficient in general anyway. And then, if it were like a 30-year-old male looking to naturally boost testosterone, you have things like ashwagandha, around 600 milligrams or something like KSM 66 in a day, anywhere from like 240 to, I think it was around 600 or something like that, or 540, is something in that ballpark, milligrams of shodan ashwagandha. It's 35% with analytes. Then you have things like fenugreek, I believe it was around 500 milligrams, and then DHEA as you get older, dehydroepiandrosterone, things like that you have naturally. But do all the lifestyle stuff first. Get your levels checked, one. If you feel crappy, get the levels checked, lifestyle stuff. Then you talk to your doctor and you say, okay, my levels are still low. You got them tested again after you made all these changes to your lifestyle. And if you had to take the natural supplements, taking the natural supplements, right? And change your diet and everything, right? Then you say, okay, now, do I qualify for TRT? So this video is really about TRT. We get excited, we love to talk about everything with you guys. We don't have all day though. But testosterone replacement therapy, again, we said people may qualify, and it doesn't matter really what age somebody is, and we prefer not to do anything unnatural at a younger age, obviously, right? I feel I have ample amounts of testosterone. I do all those lifestyle things aforementioned, and I feel great, right, in that regard. So I would never even consider it. I wouldn't consider it just to get, So be hyper aggressive here on When Wellness. But if somebody is having those symptoms, they have anywhere from 250 to 350 nanograms per deciliter, especially if they fall into those age brackets. People who are younger, 25 to 30 into their 40s, and you're way under. It could be considered even at young ages like that, but especially, I should say, for people who are older, typically 60 plus for men. They're looking to boost their libido, their vigor. They're looking to feel a little bit stronger, keep more lean muscle mass again, feel young again, right? And so I can't prescribe testosterone to anyone, so I'm not selling anything here. Kind of sounds like I am, right? But for someone like that, it might be the right thing. You talk to your doctor first. What are some negative side effects to testosterone replacement therapy? Well, they've said it might not be great for your cardiovascular health. It might not be great for your heart, right? And this long story short, just isn't true. But purportedly, by previous evidence, they would say it would lower your HDL or good cholesterol. They would say it would increase your risk increase your risk for atherosclerosis. It's something that could damage your endothelial cells, cause endothelial dysfunction, cells that line your blood vessels, right? And so, they say it would raise, at least one study showed, somebody's risk for cardiovascular disease by around 10%. But then other studies have shown people that have low testosterone and they don't go through TRT, they have a 20% increased risk of all-cause mortality, of dying from anything, by keeping low testosterone levels and not doing anything about it, right? And they would be better off going lifestyle first. But if that doesn't work, and they're still going to keep the low testosterone levels, they would be better off having them replenished to normal levels so that they promote proper physiological functioning in the body, and endocrinology, of course, right? And so, the heart health thing just really doesn't seem to be conclusive that it's bad for you. It would actually be probably more conclusive that it pretty much has no effect on your heart health in the long run, because it might actually be beneficial. Some studies show it might be deleterious, but then it's probably to a greater degree on the benefit side. I would grade it pretty much neutral, okay, in terms of cardiovascular health. So I wouldn't really worry about that as much if you've done some research and that's what you found. Prostate, they talk about enlarged prostate. They talk about it increasing prostate-specific antigen, PSA, right? And that's something that increases your risk when it's very high for, not only things like BPH, benign prostatic hyperplasia, you get that big prostate, you have issues with urination, all that stuff, going frequently and not emptying the bladder fully and all this, but also prostate cancer, right? And so obviously nobody wants to increase their risk for prostate cancer, but more recent research has debunked that, really, and has shown, TRT, if anything, in people with low testosterone levels. Again, this is in people with low testosterone levels. This is not in people with normal levels of testosterone for their age bracket. Okay, it would not be a beneficial thing to overload yourself now with testosterone, right? Too much of anything isn't a good thing. You might feel good for some time, but maybe negative side effects later. You're more likely to suffer if you already had ample amounts of testosterone. I can't drill that home enough. This is for people that have low levels of testosterone and who have been tested. But according to the recent evidence, it probably has no negative effect on prostate health. It might even have a beneficial effect on prostate health. The last thing is sleep apnea. So we know sleep apnea pretty much is your tongue getting, pressed against the back of your throat when you're laying there. You get people with thick necks have problems with this. Some snoring, it's pressing against it. They'll give you jaw retraction devices to try to pull it off. Tongue retraction devices, they'll pull it. We talked about this at When Wellness. Mouth guards are great. I've had success in patients. I recommend some mouth guards too, a good first option. CPAP is a gold standard, right? But that can be an uncomfortable machine that people use. And the reason we're saying this is because one of the major causes of obstructive sleep apnea really is being overweight, having a really thick neck. And so that kind of more comes into play with somebody that was already overweight or obese or, just a big person in general, if you're going to go through TRT. So if you don't, fall into that category, then, you're not at as much of an increased risk for sleep apnea. So that's what we got for you guys. Overall, we would grade testosterone replacement therapy as probably a good thing for people that have low levels of testosterone that have been tested, that have tried all diet, lifestyle modifications, and have still had no success. And I mean, when I say tried, you really gave it a good go, and you still didn't have success. You still have levels that are lower, around that 250 to 350 nanogram per deciliter mark, then, it might be a good thing for you. That's what we got for you guys. Hope you enjoyed it. Hope you don't have low testosterone and that you feel great. Hope you don't need it. Who do we got on here? What's up? You're doing it, Chris? Yeah. Are you currently doing it, or you're going to do it now? I hope I didn't sway you to do it if you don't have low levels of testosterone already. I hope you don't have low levels in the first place. So, Paul Rad, what's up, man? Rad Man Barry, how you doing, brother? Linder. Sweet Franz Cuevas. Chris, yeah. Chris Bryant. Another one, how you doing? Jack Colomos. Luciano, my man, appreciate you. Ricardo, hey, good afternoon, Chris. Yeah, thanks. Hannah Soul, what's up, girl? Always on. Appreciate you, at least often. Rodney, what's up? Rodney M. Shelton, he's always out here. You Androv, Mr. ENG, G Zilla, Rendaz P. Let me see if you answered that. You're doing that. You're doing it currently. How do you feel? Feel good? You probably feel good, right? How old are you? Well, we'll talk about it. Maybe message you so I don't keep everyone. But as for now, that's all we got for you folks. We'll see you tomorrow, baby. Not sure where, not sure when, but we'll see you then. Have a great one. Thank you so much. Happy When Wellness. We'll see you tomorrow.